Because a lot of people who have cancer came to me and said that, oh, doctor, I asked them, tell me what happened. Don't give me medical history. I don't want to listen to medical history. Because whoever comes to me or goes all around the world, gets treatment and then comes. So I don't want to see MRIs and all those things. I want medical history. What happened when you first found this mass in your body? What were you doing at that moment in time? What were you doing? Where were you? Who were your friends? Who was your family? That's very important. Because at that time, you will always notice there was some amount of stress in them. At that particular point, when that cancer was diagnosed, there was some amount of unrest in them. And that unrest needs to be treated. Many of the time, that unrest has been forgotten. The cancer is only a way for your body to distract you from the unrest caused to you. Because many a time, the mental pain the person goes through is worse than the physical pain he goes through. So there are very unconventional methods also, or I call them conventional because, see, I don't believe in this so-called era of modern medicine and this, what you call, so-called evidence-based medicine. Because if something works, it works. I don't care what pathway it does. You tell me how it works. Ayurveda, herbs have been there before mankind existed. From the day mankind existed, mankind had problems. They had diseases. And they were treated with diseases. How were they treated? They were treated with herbs. And they got well. Correct? That's why the generations could progress and we are here today. And since another 50, 60 years, some stupid R&D people come and tell me, show me the double-blind randomized controlled trials. That's the most stupid thing that can be done. Because when I talk about randomized controlled trials, show me the double-blind randomized controlled trial on COVID vaccine. How many are there? How many randomized, double-blind, multicentric controlled trials are there on stent? How many randomized, double-blind, multicentric controlled trials are there on cardiac bypass? Why aren't they there? Because the so-called government organizations, FDA, this DA, all those kind of people, say that it is too dangerous to conduct trials. Okay? It is too dangerous to conduct trials for that. But if I give someone some herb that grows naturally and he feels better, that is a crime. How can that be a crime? Herbs are given by nature. I can't patent them. They are not mine. I did not create them. I did not create anything. It's God or nature, whoever you wish, has created those things. All we did is just find them, crush them, and eat them. And if you're feeling better, it's good. You should. Your doctor doesn't know what you feel. Remember that. I tell every patient, your doctor doesn't know what you feel. You have to be your doctor because you know what you feel. You are the person suffering. You are the person having the headache. You can have pain, but I'll never understand how bad your pain is. You are the one only who understands that because you are the one suffering from that pain. And unless you understand that, how to treat it, it is important. And today, it is very important for us as doctors to empower our patients. Let them take health in their own hands. Let them understand how to treat themselves with small ailments. This was already there before. When you had a cold, you never went to the ENT. You did not even go to the GP, you went to your grandmother. And she gave you some medicine from the kitchen. Today that is forgotten. Somebody has a cough and they say, oh, which cough syrup shall I take? Why do you need cough syrup? You have a headache, people end up with the neurologist doing CT scans and MRIs. Everything doesn't have to be diagnosed, and every disease doesn't need a pathway. Remember, patient should feel better. That is your main thing. If you cannot make your patient feel better, we have failed as a doctor. Sometimes you just have to talk to the patient, headache goes away, cancer goes away, everything goes away. See, I'll tell you one story. When I was in our clinic, there was a young boy who came to me and told me that, doctor, I have this condition, you treat it. So I said, okay, what is the condition? He said, it's a condition called angiogenesis. So, what is angiogenesis, So he said, then I thought, because I'm a medical doctor, scientist, I'll think double always, Whatever you say, I'll think double. So angiogenesis means growing of the arteries and, anti-VEGF drugs like Avastin and all these things. I was thinking, he's a young guy, 27 years old. I said, where's your angiogenesis? Doctor, in the liver. I'm like, okay, maybe he's got some tumor or something, hepatocellular carcinoma. All those things go through my brain, And I'm thinking all these things, now what shall I do? And he gave me so many blood tests and MRIs and CT scans, MRCP, ERCP, everything. A, B, C, D to Z, everything. It was so difficult to look at those slides because, it's really difficult, when you have so many papers in front of you, you don't know what to look at. And the guy is telling you, I have this. I said, what's your symptom? He's like, no, I have this. Like, this guy works for some big company like, Microsoft or Google and software guys, I call them. Sorry, but they're all Google doctors. So I said, okay, throw all these papers away. Tell me, what is your problem? See, doctor, very simple. No doctor in India could treat me. I went to AIMS, I went to JIPMER, I went everywhere. That's why I've come to you. I said, okay, fair enough. Tell me now, what can I do for you? Tell me, how did this problem start? He said, see, I had a headache. I said, then what did you do? Then I took paracetamol. Then what did you do? It did not go away. So then I took, Combiflam for 4-5 days. It did not go away. Then I took some other A, B, C, D, other drugs. I took cannabis also. It still did not go away. So then I did full body MRI. I said, very good. Then what did you do? Then in the MRI, it was written over there, something in the liver suggests PET scan. So I did PET scan also. Then what did you do? I said, then they said to do some blood test. I said, okay, then what did you do? I did the blood test. Okay, then what did you do? He said, after finishing all these tests, I feed all these tests in Google. Google told me there are 3 diagnoses. The first diagnosis is cancer. I don't think I have cancer. Second diagnosis is some big word which I don't understand. Third diagnosis is this. So I think I have this. So this is the kind of patients you get today. So it's very important for us just to talk to the patient and tell him, I told him, you don't have anything, you are absolutely fine, go home. So he had spent an entire year going to other doctors and other doctors trying to treat the angiogenesis. And looking at the MRI, looking at the PET scan, getting something, you don't need anything. You just go home. You're fine.